Okay, welcome back to the Blue Post podcast, ladies and gentlemen. I'm your host, Anthony Fusco. This podcast episode is, of course, part of a series that's going to be focusing on Wellness and Mobility Month presented by Bell Let's Talk. Today, I'd like to welcome for the first time to the podcast my fellow colleague at the Brampton Beast, Tara. Thank you so much for joining us today. First of all, how are you, Sean, and the kids doing so far?
We're doing okay. Good. We're one of the fortunate people, so I can't complain too much. We've kind of taken this time to, work with the kids with their schooling and stuff like that to try and help catch them up on a few things. And we haven't been in a too bad of a situation, so I can't complain.
And how's the online learning going for them? Because I imagine both of them are doing that right now for school.
Yeah. This time around, when it started in March, it was more just here's assignments and we did it at our own pace. Now it's more like you're in school but online. So it's been a little more challenging.
So Tara, just when the Beast are having a normal season, because obviously this isn't normal and the team isn't playing right now, but when the team is, what's your job and what's a typical 9 to 5 look like for you?
We don't really have a 9 to 5. They're the hours are all sorts of place. Could be 3 a.m. or but no, typically on a practice day, Sean and I would arrive probably around 8 o'clock or so, depending on the time. Our practices typically don't start till around 10:30 or 11 o'clock, just kind of depending on the day and the coach. And if we have workouts, we'll be there a little earlier. If there's a workout ahead of time and the players will be there earlier, we try to get there probably about a half hour or so before the players are going to arrive. We usually have everything set from the night before. So we just kind of get there ahead of time of the players. And then typically guys will start coming in and we'll do some pre-practice treatments or taping or whatever is needed to get them ready to go back on the ice. And then they come back, they have their practice, we watch practice, and then afterwards we do some more treatments depending on, could be a player's second treatment, or it might be, somebody who likes to come in after practice as opposed to before, different things. Quite often I'll have students there, so they usually assist with a lot of the treatments. I've had really good students where I can sort of just supervise them and they're able to do a lot of the treatments. So they get a lot of hands-on experience, and it's nice because then I can get some of the paperwork done, because we have a lot of paperwork and stuff that has to be done every day. So having the students helps to save me a lot of time in the long run. So we do that. And then once all the players have left, then we clean up the room. Quite often Sean will end up staying longer because he just has laundry and things like that. And then I take on my second job as mom and usually have to go get the kids and take them somewhere to whatever activity when they still had activities to go to.
Yeah, no, I believe that. And
yeah.
Can you take me through what a typical day on the road looks like as well, for everybody that isn't you or I who's usually there and seeing it? What does a road game look like?
A lot of it is quite similar. So on a, just to go back maybe so people have an idea, a home day game, what I just described before on a practice day is very similar. We'll have a pre-morning skate, and then I'll get away for a few hours and then come back around 4-ish or so. And then we do more treatments and get ready for the game. We watch the game, cheer for our win, and then go on. Then we do some post treatments and then finally get to go home probably midnight or later, and then get ready for the next day basically. So on the road we get a little more sleep. Yes. Sometimes we're on the bus for 10 hours, so you take advantage of it when you can. Watch a lot of Netflix.
Always.
Yeah. And then or Game of Thrones, as was our
yes.
big thing a few years ago. And then on a typical game day, we'll leave the hotel, head over, again, getting there before the players. We might get there a little bit earlier than we would at home because we may not have had time to set up the night before or whatever. Just depends what time we rolled in at. Quite often, we've been very fortunate. Our players usually help unload the bus when we get in, whether it's 3 a.m. or 8 a.m. or, whatever. So they'll usually help out with that. So it just makes it easier because it takes everybody about 5 minutes when we all do it. And if it's just me and Sean unloading everything, or you're always there too, it can take a lot longer. So
Right.
as you know.
Yes.
Although we're pretty good. We have it down to about an hour and a bit, I would say. But yeah, so it just depends on how much we accomplished the evening before or morning before, depending on what time we got in at.
Yep.
And then we get ready for the morning practice. On the road, our practices are always at 10 o'clock. And it's the same thing again, just pre-practice stuff, and then post-practice stuff. A lot of times it's not so much doing a lot of treatments per se, but a lot more prep, like taping and wrapping and that type of thing. Then we'll leave, we'll go have lunch, kill a little time, about an hour or so, and then head back to the arena and get everything ready again, and then get ready for game day. And then it's the same again, where we're getting guys ready pre-game, and then just watch the game. And then after, there's not usually too many treatments. Guys might do, if there's a cold tub there, they'll do a cold tub in that. For the most part, we're on a time constraint trying to get onto the bus. So treatments are pretty short on those days for sure, as opposed to when we're at home.
What does a typical treatment look like, or does it differ player to player?
Well, it definitely differs depending on the injury in that. And definitely depending on the player's needs and what's going on. For the most part, a lot of times with it being what we call an acute injury, meaning it just recently happened, I'll do a lot of ultrasound and massage to treat for swelling and for pain and that type of thing, and ice. But then once it's more in a bit more chronic stage, that's when we do more of our strengthening and stretching and get into more of that type of stuff, band work. And then as it moves farther along, if it's something that's sort of kept the player out of play for a while, then we get to sort of a return to play, just before return to play time. And so I'll usually speak with our conditioning coach and get him sort of on board of what's going on, and I'll sort of pass the player off to him a lot of times with maybe just a few limitations or things like that, and we just communicate on what's needed for the best for the player to return to play then.
Is that where a relationship with Mississauga Physio would come into play as well?
Yeah, we've done some stuff there with them too. We've really used them a lot for bracing. They have a great bracing facility. Trevor over there has been fantastic when we've needed anything. Even this past summer, I ended up getting old and injured my wrist just playing, just hitting some golf balls with my kids, and ended up in a brace for 6 weeks. Strained something, but that's what happens. You'll see one day. You'll get over 40, and these things happen.
Well, actually, you know what? I love the segue into that. Can we talk about the process that you went through over there with the brace and everything? Because I didn't know that had happened to you.
Yeah. So as always, they're fantastic. I'll either call Albert or I'll call Trevor directly, and whether it's a player or in this case myself, and just sort of tell them my needs and what happened and stuff. And then either the player or myself will go over and get the brace. Sometimes I'll just pick up for a player if we have a specific thing and they don't really need to be sized or anything. But even we've had some players that needed custom braces, so they went there and got the custom bracing done and that. And then, like I said, in my case, I went over and Trevor was great, and we found a brace to help me through the healing period. So
And
then
you're okay now?
Yeah, I'm okay now. It took a while though. That's how I knew I was getting old. So but Albert's always great. He's the clinical manager there. We were actually we weren't classmates, but we were in the same program together at Sheridan College for the athletic therapy program. He was a year or two ahead of me, but it's a very small program, especially back then. So you knew pretty much everybody in the program, even if they weren't in your year. So, and as it is, I hadn't seen Albert for years and years. And then he ended up somehow meeting my brother I don't even know exactly how that happened. And I ended up playing hockey on a men's league with my dad and my brother, and Sean plays with them too. So
Small world.
one of, yeah, it's one of those small worlds. So we got back in touch, and he was opening up the clinic in Mississauga there, and we thought that it would be a good opportunity for us to have, you know, a connection with the beast and that. And so we've done a lot of that. They are around if we do need any therapy stuff to be done, you know, if we're on the road or something. The other thing he's been great with is our students, because ours is more of a, you know, team setting or in the arena setting, and it's not the same as the experience they would get working in a clinic. We've kind of started sharing students, I guess you could say, and the students will work there to get their clinical experience, and then work with me to get sort of the team / field experience. So it's been a good combination this year. It's worked out well because I had hired 2 students for this upcoming season, and of course that didn't work out. So I called Albert and asked him if he was willing to take them. We didn't know at the time whether it'd be a short term and we would be going in December, or what was going on, or if he was able to take them in the long term if we weren't going, which unfortunately became the case. And so Albert was great, stepped up, and so my students were able to have a placement to go to for this year. So
oh, that's fantastic. And I know that you've had a lot of great students who have come in and worked with both you and Mississauga Physio. I in an earlier one of these, I interviewed DJ actually, and he did a fantastic job. So I'm really glad to see that relationship is still alive and well, even though we're not currently playing.
Yes.
I wanted to go in and talk about, without mentioning players' names, I don't want to get anybody in trouble, but maybe talk about some of the injuries you've seen, and maybe the process of from the injury to seeing the player back on the ice. What goes into something like that?
Well, we have, obviously in hockey, there's a lot of concussions that occur is one of the things. We've had some, like any injury, they have variations. So we've had some where they're only out for a couple of days and they have no symptoms. You know, the next day it's symptom free basically. And we go through all the testing and they pass all the tests. And within a couple of days, they're back on the ice. To, you know, we've had ones that's months that we're still dealing with things. So usually I'll do some manual therapy with them to help with a lot of the secondary stuff. We've brought in some other members of our medical team, like chiropractors and that, to also assist with things, and to help with, you know, just the biomechanics of the neck that can go wrong when you've had a whiplash mechanism quite often when you get a concussion. So, and we just work through that. Usually if it's only about 2 weeks or so that the person's sort of going through it, it's pretty simple to manage, and just rest and some treatments and they're good to go again. But when they get into those long-term chronic ones, we've had to pull on some other people to come and help out, and we're finding more about concussions as we go along, that there's just a lot of other complications that become involving the eyes and involving all sorts of things. And so we've brought in other medical people to kind of help out with that type of thing. And most of the time we're able to get people back successfully on the ice. So that's always been good. Other injuries we've had, you know, some ACLs. We have a lot of MCLs that happen a lot. So that's on the inside of the knee, the ligament on the inside of the knee that gets sprained quite often. Usually those, again, are quite not too bad to deal with. A lot of it's acute, as I was talking about before, a quick injury, or you know, we're dealing with it when it's still fresh. So we use the term acute, and a lot of ultrasound, massage, and then the strengthening, and then kind of over to our conditioning coach, and then back on the ice type of things. So and we've had some long-term ones where, you know, they've required surgery. And so then, I mean, therapy sort of is always the same. It's a matter of, you know, dealing with the tissue at the tissue level, and dealing with the swelling, pain management, and then working back into getting their strength and mobility and stability with the area again. and then just getting them back onto the ice as fast as possible, and dealing with some psychological, getting them ready for games again. And sometimes if it's been a long-term injury, that can be very daunting for some players. So, just sort of working through some of the issues from a mental health perspective that may come up.
Would you say that, especially with concussion and how everybody or each player would react differently to something like that, are those one of the more difficult injuries to treat, or is there something else that comes to mind?
No, I would say that one's the most difficult because it's very hard to measure. With an MCL or something like that, we can sort of measure how much they're able to, quad push, or, like doing a quad press or anything like that. You can sort of measure and do quantitative testing on it. Whereas concussions are very much based on their symptoms, and it makes it very difficult. And symptoms can be very, very diffuse, as much as somebody just saying, I just don't feel right. And not really giving you a lot of information, but that's how they feel. They can't really explain how things are. They just know something doesn't feel right. And so trying to work as a detective and working through what they are able to tell us, and figuring out and making sure sometimes they're not doing the wrong thing, like where they're supposed to be resting, they're doing too much screen time, and not purposely necessarily trying to not do the right things, just not. Everybody's so attached to their phones nowadays, not even realizing that too much screen time with a concussion can be detrimental to their healing process. So, sort of being a detective and working your way through that way. But yeah, so many other factors come into play than just a physical injury with concussion. So,
And that's fantastic. I have a couple more just before we wrap everything up. But you spoke about concussions just now, and I thought that was a fantastic answer. And you talked a little bit about before getting guys back, maybe mentally trying to, if it's been a longer term injury, getting them back out there. And what's that process been like for you if somebody has a longer term injury and they're going to be returning to the ice for the first time in a while? How do you get them mentally ready as well?
That's where it helps. We usually start them, we call it usually injured ice. So it's sort of ice time where there's no other players on the ice with them. When they've been off it for a long time, just half of it is just getting them being back on it again and skating around and starting easy. And I think that's good mentally, because they're just so used to being on that ice that it's so disruptive to their lifestyle when they're not. So it helps to get them on the ice, like I said, by themselves. And then we work into getting them into a non-contact practice. So usually we have a special jersey that we would have them wear so players know not to hit them. We may go through with the coaches what drills are going to be happening, and say, okay, I don't think they should do these drills, but let's get them into these and get them involved as much as possible to getting them back to a sense of normalcy. And then eventually we go into full contact drills, and we'll usually get it varies, and it varies with our schedule, and so many other factors come into play. Could be only a few sessions they get, or it could be weeks where they have full contact practices. But just getting them back into that till they feel comfortable again. And you can usually tell when the player has the confidence again. There's the odd time where they're still apprehensive, and it just gets to a point where, for the most part, they're as safe as you possibly can be in a contact sport. And you just sort of have to encourage them that now's the time. It's time to go back to play. The team needs you, and you got to get back out there now. So, and it's always gone well. So that's good.
That's fantastic. And just one final question before I wrap everything up. But
Okay.
it's a little bit of a two-parter for you. So the first part is, through your job, what's the most rewarding part, and what would be the hardest part?
The rewarding part, I like the team atmosphere, the people we get to work with. It's very different than going into an office every day, or even I've worked in clinics. I like the flexibility. I mean, there's certain times, obviously, I need to be there, but it's still sort of more of a flexible job compared to, again, if I was working in an office or doing something along those lines. it's not just sort of one job. One second I'm doing paperwork and sort of dealing with insurance companies or doctors or surgeons, or so I'm more of a liaison role, to then doing the actual therapy or many different things. So yeah, no, it's it's good that way. It doesn't get boring. There's always something to do, and I find I like the travel. On one hand, I like the travel. We get to see a lot of places, and as it turns out, my husband's the equipment manager, so we get to spend time together and go and see some places once in a while. On the other hand, we have 2 children, so that's probably the sort of negative part, I guess, is especially if we're on a longer trip. Sometimes it's harder to be away from them, and you're on the phone with them and they're like, when are you coming home? And just kind of eats at your heart and stuff. But yeah, and overall, I mean, the kids once in a while have got to come on the odd trip here and there, so they get a little enjoyment out of it too. So they get to learn.
No, that's fantastic. That's amazing. And I could keep you here all day, but I think I've gone over my time limit with you. But Tara, thank you so much for being part of this today. You're welcome on any episode in the future. Thank you again so much.